Every day, millions of people take medications they trust without realizing that some can put dangerous strain on the heart far faster than anyone expects. And the most unsettling part is this. Sometimes the warning is not dramatic. It is a little chest tightness, a little pressure, a heart that feels like it is working harder than usual. Then one morning, what looked like a simple medication change turns into an ambulance ride. After years of watching patients and reviewing cases like these, I can tell you this with complete honesty. Some heart attacks are blamed on age, stress, or bad luck when the real trigger was added days or weeks earlier in a bottle with your name on it. Today I'm walking you through 7 popular medications that can sharply raise heart attack risk, especially in older adults and in anyone with high blood pressure, blocked arteries, diabetes, or hidden heart disease. We are counting down from the ones people least suspect to the one I worry about most because it is so common, so easy to buy, and capable of pushing risk up fast. Before we start, tell me in the comments your age and how many medications you take every day. I read those comments and they help shape what I cover next. Let's start at number 7. Number 7 is oral decongestants. The names to know are pseudoephedrine and phenylephrine. These are the cold and sinus medications people reach for when they cannot breathe through their nose, cannot sleep, and just want relief fast. And that is exactly why they get underestimated. A stuffy nose feels harmless, a cold feels temporary, so the pill in the cold and flu aisle feels harmless too. But oral decongestants work by tightening blood vessels, not just in your nose, throughout your body. That means blood pressure can rise, the heart has to push against more resistance, and in the wrong person, that extra strain can become dangerous. If you have uncontrolled high blood pressure, heart failure, a history of rhythm problems, or spasm in the coronary arteries, this is not a small issue. It is one of those medications that looks mild on the shelf and acts much heavier inside the body. What makes this especially tricky is that many people do not realize how often these ingredients are tucked into multi-symptom cold medicines. They are not just buying one pill for congestion, they are buying a stimulant for the entire cardiovascular system. So if you have heart disease, always read the label: pseudoephedrine, phenylephrine, oxymetazoline in some nasal products. Those are the names to catch before the pill catches you off guard. Number 6 is prednisone and other oral steroids. Prednisone is handed out every day for asthma flares, bad coughs, COPD, joint inflammation, rashes, and pain that refuses to calm down. And in the right moment, it can be absolutely necessary. This is not a medication to fear blindly, but it is a medication to respect. Steroids can raise blood pressure, raise blood sugar, increase fluid retention, and create a body chemistry that is far less friendly to the heart. In one study looking at oral corticosteroid use, current use was linked to a higher risk of acute heart attack, and that risk climbed even more with higher doses. That matters because many people do not take prednisone quietly at a low maintenance dose. They take it during flares, and flares are exactly when the body is already inflamed, stressed, and under strain. So now you have a stressed body, a stressed heart, and a drug that can push blood pressure and sugar in the wrong direction at the same time. That is why I tell people this. If you are on prednisone and suddenly feel chest pressure, unusual shortness of breath, racing heartbeat, or swelling that is worsening quickly, do not brush it off as the illness itself. Sometimes it is the medication adding fuel to a fire your heart is already struggling to control. Number 5 is migraine medication from the triptan family. The name most people know is sumatriptan. These drugs help by narrowing certain blood vessels and interrupting the migraine process. For the right patient, they can be a lifesaver. But for a patient with coronary artery disease, previous heart attack, or significant vascular risk, that same vessel tightening effect becomes the problem. A lot of people hear migraine medicine and think brain, not heart. But some of these medications carry heart warnings for a reason. There have been rare reports of actual heart attacks after use, and newer research found that the risk of ischemic events after starting a triptan was higher in people with a high cardiovascular risk profile. Now, I want to be precise here. For a low-risk person, the absolute risk is still low, but that is not the group I worry about most. I worry about the older viewer with high blood pressure, diabetes, high cholesterol, or a heart history who was never told that a migraine drug can squeeze more than a headache. If you have ever felt chest tightness, heaviness in the jaw, or unusual pressure after taking one of these, that is not something to shrug off. Number 4 is stimulant medication. This includes drugs such as amphetamine, dextroamphetamine, lisdexamphetamine, and methylphenidate. People often think of these as ADHD medications, but in older adults, they are sometimes used off-label for fatigue, low energy, concentration problems, appetite, and depression. These drugs can increase heart rate, they can increase blood pressure, and they can increase the heart's oxygen demand at the exact moment blood vessels may already be narrowed. A major study in older adults found that cardiovascular events were more likely in the first 30 days after starting a stimulant. That early window matters because it tells you the danger is not always years away. Sometimes it is right after the prescription begins. That is how these medications fool people. They feel useful, sharper focus, more energy, less fatigue. But inside the chest, the heart may be paying for that boost. If you are over 65 and a stimulant was recently added, the first month is the month to pay attention. New palpitations, chest discomfort, a blood pressure jump, a pounding heartbeat that was never there before. Those are not little side effects. Those are signals. Quick pause. If this is helping connect the dots for you, take 1 second and tap the like button. It helps this information reach people who may never think to question a prescription until it is too late. And while you are down there, tell me how many prescriptions you are taking right now. All right, back to the countdown. Number 3 is antipsychotic medication. This one worries me deeply because many people taking it never think of themselves as someone on an antipsychotic. The names include quetiapine, risperidone, and olanzapine. These drugs were designed for serious psychiatric conditions, but in real life, they are often used in older adults for agitation, sleep, confusion, or behaviors that become hard for caregivers to manage. Here is the hidden cost. Shortly after starting these medications, the risk of heart attack appears to rise. One study in older adults with dementia found the highest risk in the first month after initiation. That is exactly the kind of timing I never ignore. These drugs can affect blood pressure, sedation, movement, metabolism, and the electrical stability of the heart. They can also make people so slowed down that the whole body becomes less resilient. Families often think the person is simply fading. Sometimes they are being chemically flattened. If you or someone you love was put on one of these medications for sleep or restlessness, ask a direct question. Why this drug? Why now? What is the plan to get off it if possible? Because sometimes a medication started for convenience ends up carrying a price no one explained. Number 2 is menopausal hormone therapy. This is the one I told you to watch because it was once discussed as though it might help protect the heart. And for the wrong patient, especially an older woman starting later after menopause with significant cardiovascular risk, it can move in the other direction. Hormone therapy is not one simple story. Timing matters, age matters, risk profile matters. That nuance is important. But when we look at large landmark trials, the message becomes much clearer for higher-risk women. In older groups and in women further from menopause, hormone therapy was linked with more heart attacks, more coronary disease concerns, and more blood clots. That is not something to gloss over, especially when the patient is over 60, has high blood pressure, diabetes, obesity, high cholesterol, or a prior stroke or heart event. What makes this one so emotionally difficult is that it often begins with something understandable. Hot flashes, poor sleep, mood swings, quality of life, those are real problems. But relief and safety are not always the same thing. So this is not a message of fear. It is a message of fit. The right treatment for the right woman at the right time is very different from a hormone prescription handed out with no honest conversation about heart risk. Number 1 is NSAIDs, ibuprofen, diclofenac, naproxen, celecoxib. These are among the most common pain relievers in the world, and that is exactly why they hold the top spot. People use them for the knee, the back, the shoulder, the arthritis in the hand, the tooth, the headache, the long drive, the bad night of sleep. They are routine, and routine is what makes them dangerous. The FDA has warned for years that non-aspirin NSAIDs can increase the risk of heart attack and stroke, and that risk may begin as early as the first weeks of use. Some of the strongest research goes even further. Large analyses have shown that the risk of heart attack can rise within the first week, especially at higher doses. And diclofenac is one of the drugs that keeps showing up as particularly concerning. In one large study, people starting diclofenac had a markedly higher rate of major cardiovascular events, including heart attack, even compared with people taking ibuprofen or naproxen. That is why I never want viewers to assume that over-the-counter means light, gentle, or heart-safe. It is not, especially not if you already have heart disease, especially not if you are taking it every day. Especially not if you are combining it with other medications that also raise blood pressure or stress the circulation. This is the pill that sneaks into people's lives through pain, and pain makes people ignore patterns. A pill here, another there, a stronger one when the first stops working. Then one day, the chest pain gets mistaken for indigestion or strain, when the medication history was warning you the whole time. And here is the part I want you to remember most. The biggest danger is often not just one medication. It is the stack. An NSAID for pain, a decongestant for a cold, a stimulant for energy, a steroid during a flare. Each one may look explainable on its own. Together, they can push blood pressure up, tighten blood vessels, increase oxygen demand, and make a vulnerable heart far less forgiving. That is why medication review matters so much. Not panic, not quitting pills on your own. A careful review. If you are over 60, if you have high blood pressure, diabetes, high cholesterol, prior stents, prior chest pain, or any history of heart disease, sit down with your doctor or pharmacist and go through every prescription, every over-the-counter product, and every as-needed medication in the house. That one conversation can prevent a tragedy. Now, I want to hear from you. Which of these medications is currently in your home? Have you ever noticed chest pressure, heart racing, or shortness of breath after starting a new prescription? Tell me in the comments below, and tell me that you are going to ask for a medication review this week, because that one step may protect your heart more than you realize. And before you go, there is one more warning sign people miss all the time. Your medicine cabinet is one place your body gets in trouble. Your walking speed is another. Many people begin slowing down weeks before a major heart event and never connect it to circulation at all. That is the next video. I'll show you the early body signs your heart may be struggling to send. Stay sharp, and I will see you there.